Hi, this is your Sussex County chiropractor, Dr. Will Holdsworth from Pain Relief Chiropractic. I'm here with Robyn today. Robyn is in here because her hands are bothering her. You're getting a little bit of weakness in there. She's got rheumatoid arthritis, so we got to work today on the hands just to loosen them up and get everything moving properly again. Her right foot is also bothering her. Is there pain in there, or is it just tightness?
There's both tightness and pain in the second toe,
Okay.
and tightness in the arch.
Okay. What would you rate the discomfort on the hands on a 0 to 10 scale today?
Today would be about a 7.
Okay, and then the foot?
When I take a step, it's about an 8, and at rest, it's a 3.
Okay. All right, well, we have our work cut out for us. How's your jaw doing, too? Everything's good there?
You completely fixed my jaw.
Really?
One visit,
Cool.
haven't had a single problem since, knock on wood.
Great. Awesome to hear
Amazing.
that. That's
I tell
terrific.
everybody.
Great. All right, let's go on your stomach then, face down. And we're just going to work on her calf right now because this goes into her, this muscle, if it's tight, will affect her foot. So we got to loosen this up. And let me know, Robyn, if the pressure's too much. If it is, I can just go a little bit lighter, okay?
Just get her done.
Get her done. You doing any kayaking?
There happens to be a paddleboard on top of the car right now.
Ooh, nice. Are you going out after this?
If I can hold the paddle, yes.
All right. Then we got to get your hands going good.
Yep. Can't get it off if I can't undo it.
Where do you plan on going paddleboarding?
Swartzwood today.
Okay. That's got to be a perfect paddleboard lake.
It is awesome. There's so many coves. It's great.
Yeah. Pressure's good?
Yep, we're good. The only problem I have on that foot is on the medial side of the ankle. You can see the plate, where the plate ends.
Right.
The nerve extends over the plate for some reason. And if that gets squished between like your hand and the bone, it's not good.
Okay.
It's the only real sensitive place.
She's definitely got some tightness in the calf over on this side. So nice knot loosening up here. And we're doing muscle work today with the adjustments. I always do muscle work with people who come in with complaints. Some people just want to come in here and get adjusted. I had a new patient yesterday whose father's a chiropractor, moved out of the area. And she's like, I just want to get adjusted. Nothing's bothering me. So for those patients, I just adjust. For patients who have complaints, I'll typically do muscle work in whatever area is bothering them. And then we'll also do the adjustments. Pressure's good here too, Rob?
We're good.
How's your summer been going?
Other than this, good.
Good.
A little rainy.
Yeah, well, we're definitely going to get slammed the next week or so. It's supposed to start on Wednesday or Thursday and not stop for a week.
But heat?
What's that?
Heat?
No, rain.
Oh, sweet God.
It's supposed to be hot, really hot today, tomorrow, and then nothing but rain for a solid week.
Oh.
I know, over Labor Day weekend, it's going to be pretty annoying.
It's tight.
Yeah, a little tight here. So just loosening up her shoulders a little bit, especially good before you're going paddleboarding. You pretty good at paddleboarding?
Don't jinx me, but I haven't dumped it yet.
Nice.
I just learned this summer.
Let's go ahead and breathe in and then breathe out. In again. hand again. Good. Let's go on your back, face up, and you can slip the right shoe off.
Can I sock off too?
Doesn't matter. You don't wear shoes when you go paddleboarding, do you?
Hell no.
No.
I don't wear a ton.
Probably need to today though. There's houses on Sportswood.
Yeah, you can only do that like at remote sites.
How you tolerating this?
That's absolutely fine.
Okay.
The only real tender spot there is at the callus on that second toe where it sticks up, the prominent part.
Yeah.
And it's just a friction thing, I'm sure. You can feel the joint is, you know, displaced and inflamed. And you can feel the tendon under it. I kept thinking maybe I could just stretch a little just to get a little flatter.
Yeah.
So I try yoga and stuff. Massage and paraffin and all that good stuff.
Paraffin baths are pretty great, huh?
Pretty amazing.
Yeah. Paraffin bath is like it's a hot wax bath. You put your hand or your foot in, and
Elbows.
it'll like warm up the area.
You leave it on for 20 minutes, maybe 15 minutes.
Yeah, and then you just peel the wax off. But for anyone watching this video who has any issue with like, especially Vernon's, it's really helpful.
It has to be the paraffin and it has to be not too hot.
Yeah. Oh, you definitely don't want that stuff too hot.
Right where your hand is, your thumb,
Yeah.
and that arch, that's like so tight.
Yeah.
I can tell on the paddleboard it definitely causes a balance issue.
Yeah.
I usually strap the toe down because otherwise I can't, it's just a different feel. Throws you off a little bit.
Well, yeah, you need that for balance. Okay. Bend this knee. And rotate here. And then breathe in and out. And relax it. Good. Go flat on your back. Bend your right knee.
This one.
Mm-hmm. And then we're going to switch this grip just a little. Rotate here. And breathe in and out. Good. And go flat on your back. So the muscles that go into the hands start in the forearm. So loosening up the forearm, if you have any hand pain, wrist pain, is a really good spot to start. Stretching out the forearm, or there's a couple ways to do it. You can use your hands and kind of push them together like a prayer position, or you can just use a surface like a table or a counter, rest your hand on it, and stretch your wrist out and your forearm up that way. That really helps. Did I show you any stretches last time?
Yeah, I do them several times a day. This hand in the past week has not been able to, without pressure, straighten out by itself.
Okay.
The right hand, the left hand still can. And I've also noticed my pinky is started to get real stiff and
On this hand?
it feels, I think I dislocated it about a month and a half ago. Real quick, and I think it went back. It hasn't been right since. It doesn't look right. It doesn't feel right. It's not real pain. It just right. It doesn't, it's over more, like out.
Straighten? Yeah. A little swollen.
That's new.
Yeah.
On 3 medicines. New. So what we're doing isn't working here.
Yeah. Are they switching the medicine out and changing it? No.
They just look at you and say, well, some people it takes months. Some
Yeah.
people it takes weeks. Don't expect anything before 3 months,
Right.
which was the time frame that I'm willing to be on the stuff. With, you know, if I see improvement, okay, it's reasonable.
Right.
But to continue to take something with such high risk without some sort of market improvement is just
There's a lot of side effects.
tremendous.
Mm.
Like, I mean, methotrexate, I'm pretty okay with. It's old and it's been around forever, and you know, you kind of know what you're getting, and I'm okay with most of that. But the Humira is, first of all,
Yeah.
it's corrupt. It's corrupt as hell. They raised the price of this stuff. Like in 2008, they raised the price 100%, just like Mylan did with EpiPens.
Yeah.
And they've raised it consistently every single year since. And it's in the top 5 best-selling drugs in the world. And rheumatoid arthritis affects 1% of the population. So you tell me.
Wow. Yeah.
Something's not right there, okay? And they're using it for everything. Lymphoma is, and skin stuff are huge. And just since I've had, how many doses? 5 doses of this stuff. I'm getting moles. This was not there.
Yeah, I noticed that.
It wasn't there before. Lymphoma and melanoma are huge. And I mean, it's just a no-brainer. Like, my family is all leukemia, lymphoma. So that's a matter of time. If it's working and it gives me quality, and one of the 2 of them are going to get me in the end anyway, then okay, it's a risk I'll accept. But I'm not going to stay on it if it's not working. And it's $2,500 a dose.
Wow.
It's insanity.
Yeah.
Because they've engineered it, chemically engineered it to be so specific and apparently not reproducible that they're all just slightly different, you know? And then a lot of people are taking Narcan, like a low dose naloxone. I can't find, I can see how it would work in blocking pain receptors, but not in reducing the disease.
Yeah. It's not easy. I mean, you talk pharmaceutical controversy and all sorts of stuff for days, it seems.
Yeah, naloxone was an orphan drug. Nobody picked it up. It's only been around since 1969. And it was passed around to like 3 or 4 different drug companies. And it gets bought in the late 1980s. And about a year later, pain became the 5th vital sign. It happened to be bought by the company that produced oxycodone. So, in the medical field, we had to start documenting and treating pain. So everybody got Percocet, Oxy, whatever. That was a problem.
Yeah.
You're making money front and back.
Yeah, it gets to be an issue when one drug's side effect is counteracted by another drug's active purpose. It's pretty crazy. It's just, it's like a never-ending cycle there. I feel bad for a lot of people in the senior population. It seems like they go to a lot of different doctors, and the doctors don't communicate to each other, and they all prescribe the same drug, or like a
People don't
different.
understand. Or,
Yeah.
And then they kill themselves by accident. It happens all the time.
Yeah. My grandfather was on 4 diuretics at the same time.
You tell me
I was like,
why a
why?
drug company that's insane. Like,
Yeah.
And then his sodium, potassium,
Like just
everything's
one
screwed up.
diuretic.
His
Why do you need
potassium
4?
level, he's gonna have a heart attack.
Yeah.
Like, it's insane. But you tell me why a drug company that's marketing medication that's almost entirely taken by an elderly population is making a pill that's minuscule in size. That's ridiculous.
Yeah.
Why is that allowed? make a big pill because they're old. They can't see them. They can't feel them.
Well, most seniors that I know, they don't even know what pill does what.
The doctor
They just,
says take it.
I'm supposed
It's
to do
yellow.
this, I'm supposed to do this. Yeah, the blue one, the green one.
And then they start to skip or mess with stuff and they don't know what they're doing, how dangerous it is.
Yeah.
Sweet God, yes.
Sore?
It's just relief.
Yeah.
I'm so bad all the time.
It's not hurting right now, though.
No, you make it feel better.
Good.
Like instantly.
I could show you a massage technique to do this on your own too, to get right where I'm pushing, because this spot's really important to get after because this is really tight on you. You feel that?
Oh God, it's awful.
Yeah.
I take one of those little balls from the gumball machine, and I
Like a gumball, you mean? Or
no,
a
the
ball?
rubber ball, the hard rubber, the real small hard rubber ones,
Yeah.
and I put it there and I lean like on the table and
Yeah, that's good.
roll it.
You do it with like a marble too.
Yeah.
The little marble.
I'll put like a smooth stone into the paraffin, get it hot, but it's covered with the paraffin so it's kind of soft on the outside.
Yeah.
And just put them there and lean on them.
That's smart.
I can feel my hands, the grip getting tighter and smaller. That's partly why paddle boarding and stuff, to try to maintain a bigger grip, and
Yeah.
then I do stuff for smaller. Do you think the soreness in the forearms is just because the hands are so sore, or do you think it's progression?
You're tight here, so you're gonna be tight here, because they all they flow through here to the wrist of the hand.
Yeah, so this is pain, and this is, as it goes up, it gets to be less of an ache kind of thing.
Yeah, does it feel more tight than achy in the forearm?
Yeah.
Yeah. How's your neck doing?
Like normal, just normal stress stiff. So
Just
far, not
tight.
disease stiff.
Gotcha. Alright. So with rheumatoid arthritis, you don't want to adjust the upper vertebra, just the lower neck. Relax your head here. Because there's a space between the upper and second vertebra, the atlas and the axis, called the atlantodental interspace, ADI, and you don't want to. What ends up happening is you get ligamentous laxity between C1 and C2 in that spot, and you can X-ray it and monitor it, but I just play it safe and I don't do the adjustments on the upper neck there. I just do the activator instead, which is affectionately known as the clicky thing by most people. And we do that with Robyn. Just get the upper spot going. You can relax your head. I gotta get in there. I like your necklace. Is that an octopus?
That was a fork.
A fork?
Yes.
It looks like an octopus.
Wasn't.
So you
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 bend it.
picked it apart?
You heat it and bend it.
That's really smart.
And board easily.
Okay, Robyn, let's come up, see how you're doing.
Oh, we're good. We're
Good?
up. I can close them a little better.
Good,
Definitely don't hurt as bad.
good. What would you rate the pain in your hands right now?
It's more stiff than pain. I'd say maybe a 4, just in the really swollen joints.
Okay. Do you think you can paddleboard today?
Heck yeah.
Yeah? Good. Okay. How's your foot doing?
Good. Feels
Good.
good.
Okay, cool.
So, if you know of anybody, let me know of anybody you could recommend to try. Either a rheumatologist that's open, that is open, diet and exercise are important, 'cause
Yeah.
mine did not.
I'll look into some rheumatologists in the area.
Or, someone, a natural doctor that maybe we're not aware of.
Okay.
That might be
Yeah, and then
a good
don't say it
resource.
while we're filming, but whoever you're seeing right now, let me know who that is, and then we'll eliminate that.
He's
from-
an adequate doctor.
Yeah.
He's not, there should have been this, you don't just say you have a disease and go home.
Yeah.
There should have been, you can help yourself by doing this, this, and this, or you talk to somebody, or diet is important, something. I have
Yeah.
a doctor who tells me that diet is not an important component. You can't get well if you're not eating well.
Yeah, you got to do a more
So-
full picture approach.
When that was not even a thing, and a disease that's known to be affected by what you eat, I just took down the low blood trust, significantly.
Got it.
Okay, thanks.
You're welcome, Robyn. Thanks for watching, everyone. This is Robyn. Thank you, Robyn, for doing the video. You guys have a good day. Thanks.